This is the second part of the Chlamydia, Mycoplasma, and Plasma lecture. And we're going to talk more about chlamydia, and we are going to focus on clinical manifestations. So we have the organism Chlamydia trachomatis. And remember now, chlamydia, with the species trachomatis, is the only one that has the genus Chlamydia. Everything else is Chlamydophila now. So Chlamydia trachomatis is divided into three biovars. There's the trachoma biovar, the Lymphogranuloma venereum biovar, and mouse pneumonitis biovar. Now these biovars are subdivided into serovars. So for this course and for your exams, you don't have to focus on the biovars and all the serovars. We're just going to refer to Chlamydia trachomatis as the one organism. In general, Chlamydia trachomatis causes eye infections, and there are two different forms of eye infections. It causes trachoma and it causes inclusion conjunctivitis. So trachoma is caused by different serotypes of Chlamydia trachomatis, serotypes A, B, BA, and C. Now, trachoma is a chronic keratoconjunctivitis that's much more common in developing countries. We really don't see trachoma, the disease trachoma, in the United States. Usually in endemic areas, individuals are infected during infancy or early childhood. Transmission is through droplet aerosols, hands, fomites, as well as flies. So in endemic areas where there's a lot of flies, they can transmit. The symptoms of trachoma are acute conjunctivitis in the initial stage of infection. What happens is that if there's no treatment of the infection, the cornea starts to scar. So within 15 to 20 years of an individual having an untreated trachoma disease, blindness results. So this is a persistent chronic infection, and individuals can actually get reinfected. The major pathology of trachoma is due to the inflammatory response from the host. So you get Chlamydia trachomatis, you have a very strong host immune response against it. You have that inflammatory reaction, which causes damage and it exacerbates the scarring, in addition to the Chlamydia trachomatis causing cellular damage. So, trachoma disease is the leading cause of preventable blindness in developing countries. Very sad disease because antimicrobials can treat this infection. So here is an eye from an individual with trachoma, and they are completely blind. The other disease that Chlamydia trachomatis can cause is inclusion conjunctivitis, which is an acute inflammation of the conjunctiva seen both in adults and infants. It's more common in populations that have higher numbers of chlamydia genital infections. So what happens is it can occur in neonates during birth due to the direct contact with infected cervical secretions. So chlamydia, normally we know chlamydia as a sexually transmitted infection. So women that have a genital chlamydia infection when they're giving birth or in utero, the neonate can become infected. Usually what happens is after birth, a very tiny little newborn baby gets this acute conjunctivitis within 2 to 3 days after birth. So it's an acute pussy eye discharge, which can sometimes resolve without treatment, but usually newborns are treated right when they're born. They're treated for a variety of different types of eye infections due to contact during birth or possible infection during birth. There is an adult form that is associated with genital disease. So adults can get this acute conjunctivitis if they also have genital disease. So here is an eyelid that is flipped over with showing the inclusion conjunctivitis, very inflammatory, pussy, oozy type of infection. And this is the conjunctival scarring that can lead to blindness that is caused by Chlamydia trachomatis. Now, the infection that we are much more familiar with Chlamydia trachomatis in the United States is genital infection. So it is the most frequent cause of sexually transmitted infection in the United States. There are at least 4 million cases of chlamydia per year. It's somewhat similar to Neisseria gonorrhea infection or the disease gonorrhea, where the symptoms are in males, you can get urethritis and epididymitis, and in females, you can get cervicitis, salpingitis, and urethral syndromes. Now, chlamydia causes 40% of the non-gonococcal urethritis in men. So in males, if a man has a urethritis and a discharge from the urethra, it's commonly gonorrhea. But when it's not gonorrhea, it's usually chlamydia. Now, 1/2 of infants born to mothers that have a genital infection and might be excreting Chlamydia trachomatis during labor can develop a chlamydial disease within their first year of life. Now, another disease caused by Chlamydia trachomatis is lymphogranuloma venereum, or LGV. This is a very distinct venereal disease. It's distinct from what we just discussed with the Chlamydia trachomatis genital chlamydia. So this is one of 5 very common sexually transmitted infections. You have gonorrhea, you have syphilis, you have herpes, which is a viral infection, which we will talk about later in the semester. You have chancroid, which is your Haemophilus ducreyi. I hope all of you thought of that when you saw chancroid there. We've already been tested on that. And lymphogranuloma venereum. Now, LGV is very uncommon in the United States. There are 2 stages. The first stage is a genital lesion, very small, painless genital ulcer. And then the second stage is a lymphadenitis, where you get very large swelling of the inguinal or groin lymph nodes, along with a fever, headache, and muscle aches. So here is that inguinal swelling caused by lymphogranuloma venereum, and it can be very bad where it swells so much that it actually breaks open. Now, lymphogranuloma venereum can have systemic manifestations such as hepatitis, pneumonitis, and meningoencephalitis, and it's usually diagnosed because of that very marked inguinal lymph node swelling. However, there are other diseases we talked about where you can get inguinal swelling. So we have our buboes from our bubonic plague. There's several diseases we've talked about that can cause that type of lymph node swelling. Now we're going to move on to Chlamydophila pneumoniae, which used to be Chlamydia pneumoniae, and some people will still refer to it as Chlamydia pneumoniae. Chlamydophila pneumoniae has a worldwide distribution. Infections can be seen in individuals commonly between the ages of 7 and 30. Infections are usually mild to moderate, not super severe, but they can be severe in the elderly, although it's not a common infection in the elderly, but if elderly do get infected, it can be more severe. Now, the diseases that Chlamydophila pneumoniae will cause is a pneumonia, bronchitis, pharyngitis, sinusitis, and flu-like illness. So commonly an upper respiratory and respiratory infection. Now, Chlamydophila, what used to be Chlamydia psittaci is the cause of the disease psittacosis, and this is much more common among psittacine birds. It's also called parrot fever. So any type of psittacine bird can be infected with Chlamydophila psittaci. Now, individuals that might get a Chlamydophila psittaci infection usually are going to be diagnosed based on having a history of exposure to some type of psittacine bird and can be diagnosed serologically. There are fewer than 50 cases of psittacosis annually in the United States, so it's a very rare infection. Treatment and control of chlamydia and chlamydophila infections include a variety of antimicrobial agents such as tetracycline, erythromycin, sulfonamides, rifampin, and control is treating known cases and preventing exposure. We're going to go in and talk about laboratory diagnosis. So, for diagnostics, you can either isolate the chlamydia organisms, you can do some direct staining. More commonly, like the rickettsia, since these are intracellular organisms, you're going to do serological based testing and ELISA or enzyme linked immunosorbent assays. So, for immunofluorescence, you can use antibodies that have a fluorescent tag on them against, in this case, it's Chlamydophila pneumoniae, and it's going to make the Chlamydophila pneumoniae light up under a fluorescent microscope, and you could see the organisms nice and bright that within the cell. Now, to isolate chlamydia, you'd have to use some type of living system. So, chlamydia grows very well within egg sacs of embryonated hen eggs, and most strains of Chlamydophila psittaci grow well in tissue culture. So, clinical samples that come into the lab could be directly inoculated into tissue culture, such as McCoy cells, and then wait and see if the McCoy cells get infected, and then you can do an immunofluorescent stain and look for the inclusions in the cytoplasm. So the inclusions would be present within the cell cytoplasm several days after infection. And again, you could do either iodine staining or immunofluorescent staining. And here are some different pictures of the inclusion bodies within the cytoplasm of the cells. Here's inclusion bodies within infected McCoy cells, and these are iodine stained inclusions. Other diagnostic methods, and these are going to be more common because a lot of clinical micro labs do not do virology. Some that do virology will grow up a couple of viruses, but they don't usually grow up rickettsia or chlamydia. So you can do direct staining. So you can do staining such as tissue scrapings and do tissue stainings like GIMSA. You can do that iodine or immunofluorescence staining like we saw on the previous couple of slides. More commonly, you're going to use ELISA techniques to detect organisms in your clinical samples. And when you're using serological based techniques where you're looking for antibodies, usually you're going to do that to diagnose acute infections where you're going to see a four-fold titer increase. And if you have a high IgM antibody against the chlamydia organisms, that would suggest a recent infection because you produce IgM antibodies in initial infection, and then the IgG antibodies will come in and take over the IgM antibodies. So IgM in general usually indicates a recent infection, and IgG will indicate a previous infection. Here's Chlamydia trachomatis, and here is Geme-sustained cells, and you can see the inclusions, elementary body inclusions in the cytoplasm of the cell. Again, here's your inclusions within the cytoplasm of cells, those purple kind of big circular speckled blobs. Now, don't get it confused with the nucleus of the cells. Those, the chlamydia grow in the cytoplasm. We're going to move to the third part of this lecture.